Good morning, Lisa. How are you?
I'm great, Dr. Keltz. How are you?
It's another beautiful day.
It absolutely
Awesome.
is.
Yeah.
The roads are much better this morning coming in, which is nice.
Yeah, upstate New York, we get the snow, but it is beautiful. And what are we talking about today?
Um, the common question of clients come in maybe for their first IVF, and if it isn't successful, why did it fail? And if it maybe was egg quality, embryo quality, how do you make the decision to change it up the next time? Change the medication protocols, or do we try again to see if maybe we just need another chance?
It is the mystery. Is it the egg, the sperm, the environment,
Yes.
the implantation site, uh, the genetics, the chromosomes? Uh, it is a big mystery in all of this. And,
Absolutely.
you know, you put an egg and sperm together, you make an embryo. Even if they look beautiful, why don't they stick? And really, all these things are the possibilities. And it may just be you do it again, and it's a different embryo that you put in
Yes.
that makes it happen. But we humans get a little frustrated when you keep on doing the same thing, and changing it up, I think, is really important. So you want to really step back and look at the stimulation. Was it the appropriate medications, the
Yes.
right mixture of medications? Could you have added some enhancement with growth hormone or Neupogen? Are you on the proper supplements, the CoQ10, the fish oil, the folic acid, vitamin D? Are you doing all the methods that may be helping the blood flow in the ovaries and the uterus? Acupuncture, massage, meditation, light therapy, low carbohydrate diets, certainly really valuable in helping reduce the immune system's attack of that environment. Gluten-free may not be enough. I do believe it is really important to change up the medications. It may be you look back and say, wow, the egg production and function was really good, but maybe there was something about the sperm
Yes.
quality and quantity. And I was just talking to our urologist, Dr. Trussell, about some of the methods and how important the Conception XR,
Yes.
the Theralogics vitamins have been shown to increase pregnancy rates for men who have had sperm abnormalities. And sometimes you can't even see these abnormalities with the basic tests that we're doing. So it's adding all these little points to this. And then you get down to the you look at the egg and sperm.
Yes.
Now look at the embryo. And one of the challenges with this business is that we've all seen the worst looking embryos become babies and the best not. And we're all about this grading system, and how do we really look at the grading system and make sense of it. It's a helpful guide that may help us answer the question of, here's possibly the problem, but since we know that the environment of the stimulation is in just that one cycle is a factor. So I think it's real important to sort of step back, take the whole process in. Don't get too confused by, wow, there's so much. What can I do today?
Absolutely.
Change up the stimulation protocol. We're using more of a mixed protocol with the combination of a little more LH with Menopur or HCG. It's not a fix-all, but it's just another one of the recipes that we use that I think can be very, very helpful. And then the side of the implantation. So looks like you have good embryos, but it's just not sticking.
Yes.
We've been looking at lots of areas, and I think a big black box is the immune system.
Yes.
How do we reduce the inflammation? Antibiotics, reducing, again, the carbohydrates, increasing your vitamin D, making sure your vitamin D levels are good. The immune system is also modulated much by either intralipids or IVIG. There's not a whole lot of really solid data on intralipids, but we do have some evidence that it reduces natural killer cells. And whether you use a single or a double dose, more and more we're using it a little more frequently. That may be helping. You know, I've always wondered why we're not just putting all of this in that first cycle. it's a lot of stuff.
It is.
And it works enough with just the simple process. But it's something you really need to discuss with your fertility practitioner.
Absolutely.
And get a little bit of sense of things. Give us a call. We'd be glad to talk about these things. And I know in the support group there's a lot of conversation on this. I've always said that if you can persist and work on reducing the anxiety, fear, and frustration of the process, and that's where yoga, meditation come in, and support group, and just talking about it, it helps you keep at it, change it up, look towards there's so much out there on in the internet to ask the questions and talk about it, and be willing to explore new thoughts, new ideas, and new ways. Very important.
Absolutely.
What didn't I hit there?
I think you hit on everything. We often talk in support group if a client comes in and they're frustrated maybe after the first IVF cycle not failing. I always like to, or the first IVF cycle failing, I always like to remind them that although we've worked with many clients with maybe diminished ovarian reserve or PCOS or low sperm count, we've never worked specifically with you before. And each client is unique. And so while we have these wonderful protocols in place and we have all of this research and all these medications and procedures we can pull from, we still need to figure out exactly what works best for each individual client. And sometimes that takes a cycle or two because we need to see how the client responds and then adjust from there. So it does take some patience, but when you remind yourself that I am unique, they've never worked with me, they've never worked with my partner or the sperm sample before, and they've never seen how we work together before, it can kind of help you take a little bit of a step back and say, okay, we want to make sure we're doing this the right way. So I know it can get discouraging after the first IVF if it is unsuccessful, but then we've learned so much about you.
And there is some diagnostic information that you gain through an IVF cycle that may help you understand egg and sperm compatibility, embryo quality, just how do you stimulate in this. And we do look at some numbers, FSH, AMH, we look at a BMI, and diagnostic endometriosis, PCOS. And with those, you formulate some basic protocols in helping guide and direct the appropriate medication. And then, beautiful, it works enough, but if it doesn't in that time, we gain some information that helps us guide the next step. So it is real important to not just jump right into the next cycle, but maybe take a step back, take a breath, and give me a call and say, Dr. Kiltz, or any of our providers at CMI Fertility, or your provider out there, what can I do differently? And get out there and read, and take care of yourself here and here, which is going to help tremendously in the process of your fertility journey. And we're talking a lot about IVF, but this goes for any fertility treatments that you're pursuing on your own, and you're never on your own, by the way. We're always a team in the conversation, helping in the support, which is so important. But whether it's natural cycles, whether it's medicated cycles, whether it's IUI or IVF, I still believe that things like diagnostic laparoscopies and hysteroscopies are very valuable. I've seen so many people where we found a little bit of endo, a little bit of adhesions, and then they get pregnant. So it's a pretty amazing process. And most recently, I've been really talking a lot about low carbohydrate diets because we are really overly washed in our bodies with these carbs, and these carbs are very inflammatory producing, and our immune system is going a little crazy. Diabetes, hypertension, aches and pains, and reproductive and gastrointestinal dysfunction is really part of all of that. So if you can really begin to change what you put in here, significantly will affect the body's function, and I've seen so many people conceive just by doing that.
Great. Well, thank you again for sharing all this wonderful information with us and with our clients. I know they appreciate it. Over the next month, we have some wonderful support opportunities. On Monday, we're going to be focusing on coping with the holidays after a miscarriage, which is always challenging. And then next month in January, Sherry Ramsgard is going to come to our Syracuse Center, and she's going to do a great workshop on mindfulness. Again, being aware of what we're putting in our bodies and how it feels and how we respond to it. So be on the lookout for more information about that.
Well, God bless and enjoy the day.
Thank you.
Thanks, Lisa.